There is a passageway through which air travels from the nasal cavity to the lungs, through the nasal cavity, through the nasopharynx, oropharynx, laryngopharynx, and then the larynx and trachea. There is a food passageway through which food travels from the mouth into the stomach. Food passes from the oral cavity through the oropharynx, the laryngopharynx, and then the esophagus. The epiglottis is the band of elastic cartilage in the larynx, which closes when we swallow, and thus forces food to travel from the laryngopharynx into the esophagus. This food should not pass into the larynx, or else we would block an airway and potentially suffocate. So it is the epiglottis which saves our lives every time we swallow, forcing food into the food passageway and preventing it from traveling through the air passageways. This animation depicts how air is permitted to travel from the laryngopharynx into the larynx and trachea while the epiglottis is open. However, when food attempts this passageway, the epiglottis closes over the glottis, the opening of the larynx. This then forces food into the esophagus. Thus, it cannot block the airway when we swallow.